Hello, I'm Donn Colby at the U.S. Military HIV Research Program and a consultant at the Institute of HIV Research and Innovation in Bangkok, Thailand. And today I'm going to talk about strategies to promote PrEP use in Asia. And we'll look at some examples of best use practices for PrEP scale up in Asia. First, my disclosures. So I think it's useful to start with a little bit of data about the epidemiology of HIV in Asia to see what the problem is, so we know what PrEP is doing in terms of a solution. So first, in terms of HIV transmission in Asia, this slide shows the risk groups for HIV transmission for the latest data we have available in 2019. And what we can see from this is about 3/4 of new HIV infections in Asia occur in high-risk groups, including sex workers, people who use drugs, gay men or other MSM, and transgender people. The important point of that is these are all groups that are easily identifiable by their behavior or their identity groups. So these are groups that can be targeted for PrEP programs as part of a program to try to eliminate HIV in Asia. This slide shows the latest data from PrEP Watch in terms of how many people have started PrEP throughout the different countries in Asia. And what we can see is there is only one country in Asia that has over 25,000 PrEP starts to date, and that is Australia, which has had the first PrEP program in Asia and has probably progressed the most. But we also have a couple other countries in Asia that have quite developed PrEP programs that are expanding PrEP availability very, very rapidly. And those are Thailand and Vietnam. And then a lot of other countries are more in the startup of PrEP, including Taiwan, Myanmar, Cambodia, and the Philippines. So what I'll do now in the next few slides is look at some of the best practices in terms of PrEP scale up and the programs that have been the most successful in terms of scaling up PrEP to date. But before I get into the different countries, just to note that Asia has 60% of the world's population, but to date only 9% of the PrEP initiations. So Asia really has a way to go in terms of scaling up PrEP and catching up with the rest of the world. The last time I did this presentation in 2020, Asia had 10% of the world's PrEP initiations. So in the last year and since COVID came along, even though Asia is scaling up PrEP and more people are getting on PrEP, the rest of the world is going a little bit faster. So Asia really does have its work to do in terms of catching up with the rest of the world. First, let's take a look at Vietnam, because that's one of the success stories in terms of scaling up PrEP over the last few years. Vietnam has a concentrated HIV epidemic, concentrated in high-risk groups, including MSM, transgender women, people who inject drugs, and sex workers. The national program for PrEP in Vietnam just started in 2017, but over the last couple of years, they've got to almost 20,000 people on PrEP through the first quarter of this year. And the Ministry of Health goal for PrEP in 2021 is 38,000 people. So how has Vietnam done this, scaled up PrEP rapidly and more rapidly than a lot of other countries in the region? And it's really taken a partnership between a lot of different players for Vietnam to get where it is today. First of all is the Vietnam Ministry of Health, which added PrEP to its national guidelines in 2017 and was able to start demonstration projects of PrEP in the same year. The national program for PrEP just started in 2019 and has scaled up rapidly since that time. They work with international agencies that provide funding and technical assistance, including PEPFAR, UNAIDS, and PATH, but they're also working with local institutions to do PrEP delivery. So that includes Hanoi Medical University, which has a kind of unique clinic I'll talk about a little bit more in a minute, and working with provincial health departments throughout the country. But I think most important and key to both Vietnam and we'll see to some other countries is working with the key populations through the CBOs or community-based organizations, because those are the organizations that are on the ground have access and good relationship with the community and are able to bring together PrEP, at the national level with the community level where the people who need it are. And a couple of those local CBOs or NGOs that have been quite active in this field are G-Link and Karma, which are both based in Ho Chi Minh City. So the PrEP services in Vietnam are delivered through a variety of different types of clinics or service delivery models. First is the public ART clinics. And I think the Ministry of Health chose to use the public ART clinics because they had everything they needed to dispense antiretroviral medicine, which PrEP is, to the people who need it. Second is the key population CBOs. And most of these CBOs are targeting MSM or transgender women. And to date, actually, the CBOs have been the most effective at getting PrEP out to the population. And then they have a specific clinic called the SHIP, or Sexual Health Promotion Clinic, that's based at the Hanoi Medical University, and it targets services specifically for MSM in Hanoi. So this just shows a little bit about the SHIP, or Sexual Health Promotion Clinic, at the Hanoi Medical University. And this is sort of a model for a public university, but targeting services for a high-risk population, which are MSM in Hanoi. And when this clinic opened, there was no other services specifically for MSM in Hanoi, or really anywhere in northern Vietnam. And they work with MSM from the community to target PrEP services in a friendly way for high-risk people in the MSM community. And they've been very successful. And I think to date have over 2,500 MSM who have started PrEP in their clinic. Another example of PrEP services targeting high-risk populations in Vietnam is called PrEP for Love. And this is also a KP, or key population-led service that supports 12 private community-based organizations who have their own clinics and 6 public clinics to deliver PrEP to the community. And this project receives financial support from PEPFAR with technical support from the international NGO PATH. And this has been successful. And I think they have about 6,000 or 7,000 MSM who have started PrEP to date. And one thing I think note mentioning is delivering PrEP during the era of COVID. And of course, everywhere in the world has been affected by COVID. And I think most PrEP programs and ART programs as well have also been affected in figuring out how do we deliver PrEP services or ART services, depending on what you're doing, to the population that needs it during the time of COVID-19, where we may have lockdowns, we may be restricted in people going outside or getting to work or getting to clinic to pick up their medicines. And this chart just shows how new PrEP starts sort of progressed during the COVID time through the PrEP for Love program in Vietnam during the first 5 months of 2020. So we can see from the chart starting on the left, the beginning of the year, PrEP starts, they had over 100 people a month starting PrEP. And then Tet, or the Chinese or Vietnamese New Year, came at the end of January to February. And then PrEP starts went way down, and that's kind of normal because everybody goes home to see their family for a couple of weeks during the Tet holiday, and then they go back to work or school or wherever they live. And things went back to normal by the end of February. But then COVID came and all the lockdowns came, and new PrEP starts went way down for a few months. But after a couple of months, once the COVID restrictions stopped, and they instituted some programs to reach out to the community often through the internet or electronic means to promote the PrEP services and encourage people to come back in. PrEP starts quickly within a month or two bounce back to where they were before. So this is a good example of how a local community organizations were able to respond to PrEP or to respond to COVID in able to continue to promote and deliver their PrEP services to the community that need it. And I think a couple of innovative things that they were able to do, and I know people have done throughout the world, is things like deliver PrEP to their clients who were not able to come in and get it itself, and also to deliver services like counseling services, and oftentimes things like HIV testing, where people were able to do at home with counseling through the internet, so that it did not require a physical meeting during the time of COVID. Next, we'll talk about Thailand, because Thailand is another example of a successful rollout of PrEP over the last few years. PrEP has been available in Thailand since 2014, and it was included in the National Health Service Organization, or the National Health Insurance Program in Thailand since 2019. And by the end of 2020, they had over 18,000 people taking PrEP in Thailand. But I think a couple of things to note from this graph. One is that although PrEP has been scaled up very rapidly in Thailand, the number of people on PrEP is still only about 13% of the estimated need for PrEP in the country. So there's still quite a ways to go in Thailand in terms of scaling up PrEP to more people, even though it's been improving and rising quite rapidly. The second thing to note from this graph is that the majority, or more than 50% of the PrEP starts, are taking place in the key population-led services. And to date, it's only a small percent that are receiving PrEP from the traditional service delivery, like the hospitals or the public clinics. So we'll take a little, in the next few slides, we'll take a little bit more look at how the KP, or key population-led services, have been able to expand PrEP so rapidly in Thailand. So the key to I think the key population services is to make them sort of accessible and easy to access and use, and friendly for the people who need it. And a couple of the words that they use, that how they want to design their services, is to simplify, demedicalize, and differentiate PrEP services. In a minute, we'll talk a little bit more about what those terms mean, but really it's an effort to get PrEP to people who need it with the least number of barriers for them. And key to this has been a cooperation between these KP-led services and the more traditional health services like the hospitals and clinics. So in this model, the community outreach and usually the first meeting with the client or the high-risk individual is usually led by the key population, or the people in the community. So they have HIV testing services, which is often the first entry to PrEP for most people. And that's led by the key population services, and they can do the counseling and draw the blood for the initial HIV test. Now that test has to go out to a standard lab somewhere, and it needs to be reviewed by someone in the medical system, like a doctor, because in Thailand, as in most countries, PrEP is a prescription med, and you need a physician prescription in order to dispense the medicine. But once the blood test comes back and it's reviewed by someone in the hospital, if the physician in the hospital agrees that PrEP is appropriate for that person, they're able to write the prescription, and then the CBO can dispense the medicine to the client, can get them started, can make an appointment to come back in a month or 3 months or whatever is appropriate, and then they can manage the follow-up for that client. Another aspect of the program in Thailand that has been quite successful is the outreach and the advertising or marketing of PrEP services to the community. One of the new marketing programs they have is called PrEP in the City. And this is a marketing campaign that is focused on transgender women in Thailand, because we know that's a large group in Thailand, and we know that this group has a high risk for HIV. So the Sex in the City was the first campaign for transgender women in Asia, and was also designed and produced by transgender women for transgender women. So they chose as their models 4 transgender women from Thailand, and they were selected to represent kind of a diversity in the transgender community in terms of age and physical appearance, so that the campaign could sort of reach out and be personable or really reach all members of the community. And what they highlighted was, kind of framing messages from a positive standpoint. It wasn't, the traditional sort of HIV, HIV is bad and you don't want to get it, but it tried to be more sort of positive about living a healthy life and PrEP use as part of living a healthy life. And the other thing that it did is it increases the visibility of transgender women, both in Thailand in general, because this campaign was very public, and I'll show some examples of that in the next slide, but also highlighting within the Thai healthcare system as well. And this just shows some of the locations where this advertising was occurring in Bangkok. So this included the BTS stations, and the BTS is the subway and train system in Bangkok, on public buses as well. And those buses are going everywhere in the city. And then in large billboards in major intersections in Bangkok as well. So it's a very, very visible campaign. And it's been a very, very successful campaign in terms of getting transgender women into PrEP services. And then finally, I want to mention PrEP in Taiwan, not necessarily as the most successful PrEP program in Asia, but really the newest program in Asia, because this program to provide PrEP mainly to MSM and other high-risk groups in the public sector, and this is the first public sector provision of PrEP in Taiwan, and it was just launched in April of this year. So the PrEP is available in 37 hospitals and clinics throughout Taiwan, and they do a combination of daily PrEP, aiming at the female partners of male people living with HIV, and then they use event-driven PrEP for males that are young but high risk for HIV, or they have a partner who is HIV positive, and they're planning for up to 1,500 PrEP clients in the first year. I think the one thing that you'll notice missing from the Taiwan PrEP program that was a key feature of the successful programs in both Thailand and Vietnam was the focus on key population-led services, or the community-based organizations, or local NGOs. And I think that that focus on key populations and using the community to help reach the high-risk people in those communities was really key to the success in Thailand and Vietnam. We don't see that model so much in Taiwan yet, so it'll be interesting to see over the next year or 2 years how quickly they're able to scale up PrEP in Taiwan, and if eventually they want to bring in more of the community-based services as well, because that seems like a key component of the successful programs in Asia to date. And then I'll end with this is the last slide to say, what are the key components or things to think about when designing a PrEP program that's going to be successful in meeting the needs of the high-risk population, and being successful at getting people who need it on PrEP, as quickly as we can. So this is a slide from Kim Green, who works at PATH in Vietnam, has been instrumental in scaling up PrEP in Vietnam, and then also some other countries in the region. And she really promotes, 3 basic ideas. So one is to demedicalize, and that's really to get PrEP out of the big medical centers or the big hospitals in the cities, that present barriers to people for access, and get it out into the local clinics, which can be the public clinics, or maybe the community-based clinics as well, which are closer and easier to access for most people. The second is to simplify, and that's looking at less complex ways to deliver care, including PrEP services. So that would be everything from HIV testing and counseling to the actual dispensing of PrEP medicine, and doing blood tests like HIV tests or whatever tests are needed done to monitor people who are on PrEP. Simplify is also a way to decrease costs, both for the program that's supplying PrEP and for the clients as well. And lastly, is to differentiate. And that really means to change and adapt our systems in order to best meet the needs of the clients of the system, in this case, for people taking PrEP. And certainly in 2020 with PrEP, we all learned, the need to differentiate or change what we do to adapt to the local situation. And I think in 2020, we all had to change a lot more and a lot faster than we ever had to do in the past. And as we, leave the COVID era and these things kind of go back to normal or whatever the new normal is, we need to look and see, what parts of the old system, are worth keeping and continuing or going back to, but what parts of the old system maybe were not necessary or may have been a barrier to accomplishing PrEP or whatever it is we're doing. So what part of the old system do we need to keep, and what parts of the new system do we need to keep as we build a new system to move forward and hopefully, deliver more services to more people in a more efficient way and a more friendly and hopefully more effective way as well. So with that, I'll end the talk and just acknowledge the many people and organizations who provided information or data for my talk. Thank you.